Hypertension or high blood pressure is a significant medical disease that, if left untreated, could have catastrophic results. There are several warning indicators that high blood pressure may be a serious health issue, even if it may not always show symptoms. In this video, we'll go through 10 fatal indicators that could indicate your high blood pressure is a ticking time bomb. Number 10 on our list is severe and persistent headaches. One of the telltale indicators that your high blood pressure may be a ticking time bomb is severe and ongoing headaches. Consistently elevated blood pressure places too much strain on all of the body's blood arteries, including those in the brain. Headaches, particularly in the back of the head, might result from this elevated pressure. High blood pressure headaches are frequently described as severe and throbbing, and they may be accompanied by additional symptoms like nausea or dizziness. These headaches can get worse with physical activity or changes in body position and are typically worse in the morning. Number 9 on our list is vision problems. A serious warning sign that your high blood pressure may be a ticking time bomb is vision difficulties. Hypertensive retinopathy, a disorder caused by chronic, uncontrolled high blood pressure, can harm the small blood vessels in the eyes. If neglected, this illness has the potential to result in irreversible damage and a variety of vision issues. For the purpose of identifying and managing hypertensive retinopathy, routine eye exams are essential. Your retina's health can be assessed by an eye doctor, who can also look for any anomalies that might be caused by high blood pressure. Maintaining a balanced diet, exercising frequently, controlling stress, and taking prescribed medications can all help to greatly lower the risk of high blood pressure and safeguard your vision. The next one is chest pain and is a very common symptom. Chest pain is a serious indicator that your high blood pressure may be a ticking time bomb. The additional stress that high blood pressure places on the heart can result in a number of cardiovascular problems, including chest pain. High blood pressure-related chest pain is frequently reported as a tightness, pressure, or discomfort in the chest region. It can extend to the arms, shoulders, neck, jaw, or back and feel like someone is crushing or clutching your chest. Breathing difficulties, lightheadedness, or a sense of impending doom may be present along with this pain. Coronary artery disease, CAD, a disorder where the arteries providing blood to the heart narrow or become clogged, can be brought on by high blood pressure. Chest pain, commonly known as angina, can occur when these arteries are unable to supply the heart with enough oxygen and nutrients. It is critical to get quick medical help if you feel chest discomfort, particularly if it is severe, chronic, or coupled with other alarming symptoms. A medical expert can assess your symptoms, run diagnostic testing, and identify the underlying reason of your chest pain, including any potential blood pressure connection. Number 7 on our list is shortness of breath. High blood pressure can put strain on the heart and blood vessels, which can result in a number of cardiovascular problems that can impair your ability to breathe. Consistently high blood pressure might make the heart work harder to pump blood throughout the body. The tissues, particularly the lungs, may not receive enough oxygen as a result of this increased burden. As a result, you can have shortness of breath or breathing difficulties, particularly when engaging in physical activity or, in more extreme circumstances, even while at rest. High blood pressure-related shortness of breath may potentially be a symptom of heart failure. Over time, high blood pressure can cause the heart muscle to deteriorate, making it less able to efficiently pump blood. Fluid can build up in the lungs as a result of an unhealthy heart, making it difficult to breathe and making you feel out of breath. Number 6 on our list is fatigue and weakness. The heart is strained by persistently high blood pressure, which makes it work harder to pump blood effectively. As a result, the body might not get enough oxygen and nutrients, which could make you feel weak and exhausted. This may show itself as persistent feeling of exhaustion, a lack of energy, and trouble doing routine chores that were previously doable. Additionally, other cardiovascular problems, including heart failure or arterial disease, might develop as a result of high blood pressure. These diseases can make weariness and weakness worse because they impair the heart's capacity to pump blood efficiently. It is crucial to speak with a healthcare provider if you consistently feel weak and tired, especially if they are present together with other signs of high blood pressure. Number 5 on our list is irregular heartbeat. Atypical heart rhythms can result from high blood pressure interfering with the heart's regular electrical messages. Consistently high blood pressure might make the heart work harder and become more taxed. The electrical system of the heart may be altered as a result, causing irregular heartbeats. Atrial fibrillation, AFib, atrial flutter, or ventricular arrhythmias are only a few of the arrhythmias that might be connected to elevated blood pressure. An irregular heartbeat can cause the chest to feel as though it is hammering, racing, or fluttering. Other symptoms, including lightheadedness, dizziness, or shortness of breath, could also be present. Arrhythmias occasionally put people at greater risk for more serious cardiovascular issues, including heart attacks or strokes. Number 4 on our list is blood and urine. Blood arteries throughout the body, including those in the kidneys, can be harmed by high blood pressure. Due to this damage, blood may seep into the urine. Hematuria can occur as microscopic hematuria, where blood can only be seen under a microscope, or as gross hematuria when blood is visible to the human eye and gives the urine a pink, red, or cola-like color. It's critical to remember that hematuria might have reasons other than high blood pressure, such as urethral or bladder infections, kidney stones, or urinary tract infections. But when high blood pressure is a contributing component, that usually means kidney damage or a condition called hypertension nephropathy. Changing one's lifestyle and using medication to control high blood pressure can help stop additional kidney damage and lower the chance of consequences from hematuria. Number 3 on our list is numbness or tingling sensations. Long-term, unchecked high blood pressure can harm blood arteries all across the body, including those that deliver oxygen and nutrients to the neurons. High blood pressure can harm nerves, resulting in paresthesia, which is characterized by numbness or tingling. Peripheral neuropathy, the result of this injury, can cause unusual feelings in the hands, feet, or other parts of the body, such as tingling or burning. Because of high blood pressure, the nerves' normal function may be hampered by the lower blood flow to them. Peripheral neuropathy can advance and cause other issues, such as balance and coordination problems if it is not treated. The next one on our list is swelling. In addition to strained blood vessels, high blood pressure can throw off the body's fluid balance, causing fluid retention and eventual edema. The lower extremities, such as the legs, ankles, feet, or hands, are frequently affected by the swelling that high blood pressure causes. After a long day of standing or sitting, or at the end of the day, it could be more apparent. In addition to having a puffy or bloated appearance, the swelling is typically accompanied by a tightness or discomfort in the affected area. Consistently high blood pressure can hinder the cardiovascular system's ability to operate normally by hindering the effective exchange of fluid between blood vessels and surrounding tissues. As a result, extra fluid may collect and cause edema. Number 1 on our list is nose bleeding. Although there are many different reasons why nosebleeds occur, such as dry air, trauma, or sinus infections, persistent or severe nosebleeds without a known cause may be related to high blood pressure. Blood arteries all over the body, including those in the nose, can get damaged by high blood pressure. Blood vessels may be more likely to rupture as a result of the increased internal pressure, which can cause nosebleeds. Heavy bleeding from one or both nostrils is the typical symptom of nosebleeds linked to high blood pressure. They could develop on their own or after a small injury or nasal irritation. Consult a healthcare provider immediately if you have frequent or severe nosebleeds. They can analyze the state of your health, take your blood pressure, and look for any underlying issues. So these were the 10 fatal signs that your high blood pressure could be a ticking time bomb. If you are aware of any other such symptoms, do let us know in the comments below.